What does enlarged tonsils, poor sleep, inability to concentrate, and poor immune health have in common? Your mouth. Crazy, right? Get ready to embark on a path to learn with me how your mouth structure can correlate back to your health more than you ever thought. What if your child was exhibiting symptoms that actually link back to the fact that they are a mouth breather when they sleep? So many crazy correlations you're going to learn. Dr. Nora Ghodousi-Zaghi is a diplomat of the American Board of Pediatric Dentistry. She has an expertise in functional and biological, minimally invasive pediatric dentistry with a specialty in maxillofacial development expansion and interceptive orthodontic appliance techniques, sleep, breathing, and tongue ties. She is the pediatric dental director of Breathe Kids Dental Institute in LA and provides pediatric dentistry with an integrative and interdisciplinary approach. She works with expert providers across multiple disciplines such as ENT, sleep, myofunctional therapy, SLP, and others. Get ready to have your mind blown. Let's jump in. Hey, it's Autumn McLeese, your birth doula and Crunchy Mama source for choosing healthier, alternative ways of living. Because when you know better, you do better. Join me as we explore topics that might challenge what you know to be true when it comes to health, birth, and beyond. Let me help you think outside the box and empower you with steps to do better. Your best life could be on the other side of this next podcast, so join me now. Well, hello, Dr. Nora. Thanks for joining us today on the podcast.
Thank you so much for having me. I'm excited to be here.
Oh, I'm so excited you're here. I know we're all going to really learn some great stuff. Some of you, your mind is going to be blown. You're going to walk away and think, oh my gosh, I need to get myself a holistic pediatric dentist for my kids because there is so much to learn when it comes to, I know, our oral health and how that correlates to our internal health and our organs and everything. So let's jump right in. I want to hear a little bit about you. When you started your work in dentistry, did you begin your practice in pediatric holistic dentistry, or did you start in actual just like a mainstream practice type field?
Yeah, so that's a really great question. I feel like everybody's journey as a practitioner kind of stems from different places. And for me, I discovered the realm of this whole body focused pediatric dentistry in my residency. I learned this really simple concept, and it was form follows function. Wow, not everything is genetically bound. So, how we eat, our structure, how we breathe, it all connects to how we grow. And I started to notice an inherent difference in how patients' faces essentially grow differently based on habits, genetics, environmental influences, structural influence, but also how they breathe.
Wow.
So instead of just focusing on symptoms of disease like decay or crowding, these are symptoms. Our goal is to better understand the why. Why does this occur? Why does this matter? So these are all things that functional and whole body focused pediatric dentists are looking for.
And you've already taken things deeper than the average dentist, just right there. Let alone, I'm just so excited that you're working with kids because the fact that you are out there helping impact their little lives for the better at such a young age versus getting to the place where, you know, I am as an adult and trying to work with some of this, which I'm sure you still can, but the fact that you can get to them so much earlier, what a blessing.
Yeah,
So tell us about
matters.
Tell us about the Breathe Kids Dental Institute that you work at and are very much a part owner, right?
So Breathe Kids Dental is my department. It's my I'm the pediatric dental director of it. And what I do is I focus on just whole body focused dentistry. And that includes working with multiple practitioners. So I'm really lucky to be able to collaborate with other practitioners. And this can include my husband, who's an ear, nose, and throat physician and a sleep surgeon. So he really focuses on treating patients functionally. In addition to myofunctional therapy, sleep, so we have like sleep hygiene practitioners. We have a sleep, speech, and language pathologist. We have an infant, um, a dentist that treats infants and people that just vary with various backgrounds that we can work with in treating our patients. So it's all about collaboration and working with, not looking at our children not from one direction, because when we see a problem, there are multiple, sometimes multiple pieces to the puzzle that are necessary in order to treat it. And it's important to work with providers that understand that so that we can get to our greater goal, which is whole body wellness and health.
Mm. And I think just the theme of us talking about this could be an epiphany for some people, realizing, like, gosh, I haven't really linked the fact that my mouth so much correlates with my health. So this is just so needed to bring awareness to this topic. I'm just elated that you're here spending this time with us. So you've kind of started to talk about how holistic dentistry is different than traditional. Any more you can say to that in those differences to help the average person listening, the average mom, you know, see these differences more clearly as to why they need to choose this route?
Totally. So, when as a whole, like a holistic dentist, our goal is and our focus is treating patients with biologically compatible materials minimally invasively with conservative treatment options and really getting to the root cause of disease. So for me, it's focused around providing treatments such as ozone, BPA free products, fluoride free options, and focusing on education and prevention with options like hydroxyapatite, for example, which is minimally invasive, made of organic matter, and that's what our teeth are made of. But when we look at traditional dentists, it's really a band aid for a problem. We see a cavity, we fix it with what we have. We see a crooked tooth, we align it. We see grinding, we put a stent on. But we really need to seek out the why. What's going on? Are they mouth breathing? Is it diet? Is it nutritional deficiency? What's the root cause of the problem? How can we resolve it? For example, nutrition. What happens to our bodies when we're introducing these inflammatory oils, these foods? Not only do they break out down into acid, but they also cause us to breathe off an acid and mouth breathe because of our diet. And also D3. We have a chronic D3 deficiency, I think, in the States. And that's because maybe we're not getting enough sunlight. It's not, we're having deficiencies in our diet. And I think I see it affecting children and the quality of their teeth. And so something that I do during my wellness exams is I spend a full hour on a comprehensive examination for a patient, me and the patient, 1 full hour. And I go through what they eat, the textures of what they eat, what they drink out of. I talk about vitamins, nutrients, birth history, so much, because all of this can play a role in how I treat my patients. My treatment plans are individualized. Never will I give two patients the exact two same treatment plans, even if they have the same exact symptoms, because every child is different. And I want to repeat that every child's different. And that's important. And I see that lacking not only in traditional dentistry, but also in traditional medicine. So, yeah.
I feel like I'm speechless over here because this is like a dream. I didn't know that there were dentists like yourself that went this in depth. I mean, you even spoke back to birth, which is obviously my jam, right? I mean, I have my own
Yeah.
passions for helping women in, birthing their babies and helping that unfold as naturally as possible. But I mean, you're going deeper than I ever imagined. And I'm sure we're all a little bit taken back right now about what you're saying. And I'm just thinking, gosh, why is there not more of you out there? Like, I feel like we've got dentists on every corner and all of them
Yeah.
just want to come in and drill out cavities. I've been mortified at some of the dentists I've taken my kids to the
Totally.
point where I'm skeptical of one little thing that they said. I take them to another dentist to get a second opinion. And sure enough, I find that they really don't have those cavities that they wanted to drill out. I mean, it is so frustrating and scary. And then to learn how much all of this impacts our health and just how mindlessly we're going around just trusting these dentists. And now you're helping open our eyes to this. So incredible. Let's move into
Thank you.
some of these topics. So, you've mentioned sleep, breathing. I know you and I talked attention span, overall health. Like, how is it that our mouth can correlate to our sleep? How can it correlate to, our oxygenation in our body, our attention span? Just give us a couple examples so that we can help kind of wrap our minds around what you're saying.
Totally. And that's such a good question. And I feel like patients are actually more educated than some doctors that I know. And I feel like after your listeners listen to this podcast, they probably will too. So,
I
the
love it.
floor of the nose is the roof of the mouth. And I want to repeat that so people really grasp, okay? So, when you're looking at the roof of the mouth, please acknowledge that it's also the floor of the nose. It's one and of the same. So our tongue, it's the driving force of the premaxilla, which is our upper jaw. If our upper jaw is underdeveloped, and that could be due to nasal obstruction, genetics, so many things, it's really a sign of or symptom of something greater. And that can mean that our bones are small, secondary to an airway or a tongue issue. And this can lead to sleep disorder breathing. So, when we're looking at mouth breathing, for example, and tongue posture, so we're also evaluating the structure, function, and the behavior of the child to give us a diagnosis, to give us an idea as to why. So, the size of our jaws directly influence the size of our airways. So, for example, if the tongue is low or the roof of our mouth is very high and narrow for whatever reason, it can cause our tongue to fall back into the airway and cause obstructions or sleep apnea, sleep disorder breathing. Does that make sense? Because when
Yes.
we're asleep, all the muscles in our body are relaxed, including the 16 muscles of our tongue. Our tongue is like a car and the mouth is a garage. And if it doesn't fit, then it's only going to go where it can go, out of the mouth or in the back. And if our
Mm.
tongue continues to consciously stay down, it can affect speech because we're not able to elevate the tongue comfortably due to structural issues. It can cause mouth breathing, which is one of the first signs of sleep disorder breathing. So it's really important that parents are aware of that. And when we mouth breathe, extra stress is put on the body to get oxygen, right? So it triggers this sympathetic nervous response and a fight or flight, which prevents us to go into deep sleep. And when we don't get
Wow.
into that deep, juicy sleep, we prevent the release of things like growth hormone, which happens in stage 3 sleep that helps our kids grow and us grow. And it prevents us from like memory consolidation, for example. So our kids stay wired because they're not getting in that amazing sleep they need. And they're not able to get that full rest, get back into homeostasis. So that's when we see these ADHD like symptoms, kids that aren't growing. It all is connected and it all matters.
Um, what about like thumb sucking or pacifiers? I mean, can those things contribute to the roof of the mouth being in a poor state or forming poorly?
So that's a really interesting topic. There's something, so right behind your two front teeth, try to reach that spot behind the two front teeth. That's something called, there's a nerve there that helps us stimulate our parasympathetic nervous response, like how to relax. So when we have our tongue up there, it helps us relax. So sometimes if a patient has like a tethered tongue, we could talk about that more. What we notice is that their tongue isn't able to get up there to be to that spot in order to release the parasympathetic nervous response, meaning that kids might would come out of the womb needing to suck and soothe, that spot to help relax, to release those hormones like dopamine. For example, those are all released when we suck and stimulate that spot. Uh, Pacifier usage can also help with that as well. So we try to redirect behaviors like, for example, when a child's thumb sucking, we'll redirect or use appliances to help with stimulating that area rather than using the oral habit of thumb sucking. Or pacifier usage, we can also redirect and replace it with something else, like an appliance. That can be done at around 6 months of age. So those are ways that we can help, redirect. But it's always important just to get an airway assessment from a functional pediatric dentist, or airway focused pediatric dentist to understand the why. Is it something that's habitual, or is it related to something deeper? So that's something we have to understand when we're assessing our children.
I'm thinking back to some of the things that you just said with, you know, potential behavioral problems because children aren't sleeping well because of their mouths. It's like, who would ever think my child, it has outbursts and, is just hyperactive, and we think so many other reasons, or, we're treating them with medication, and
Mm-hmm.
to know that this is even a possibility, that it goes back to their oral structure of their mouth. I can't believe this isn't out there more. I can't believe it. So we've got to get you out on more podcasts so more people can hear, because
Yeah.
this is very profound. So let's dive into
Thank you.
then the traditional dentist that is taking the average child. We're putting, amalgam fillings in. We're, maybe pulling teeth. I don't know what age they normally do root canals, but, the average pediatric dentist, can you give us some examples of how this could harm a child's health or set them up for failure, essentially, for the rest of their life, because maybe they're being too proactive with some of these situations, that, or we're not even addressing them appropriately. What do some
Mhm.
of those scenarios look like that we need to be mindful of?
Yeah, so I think it's very important to have an understanding of what materials are used in dental offices, because they're being put into a child's mouth, and it's going to be in there for a very long time. And what that means is that, for example, we have mercury based fillings, which are also known as silver fillings, such as amalgam. And it's been known to essentially release mercury over time, meaning that throughout usage, meaning chewing, functioning, grinding, over time, more mercury can be released into the bloodstream, and that matters. That can affect a child's health, and an adult's health. So, and it also, in addition, it can also cause a dentist to need to remove more tooth structure. So, mercury-based fillings require the tooth, since it doesn't require certain types of materials that we use to help hold onto the tooth structure. It requires us to remove more tooth structure than necessary sometimes, in order for the filling to stay in, to have good durability and strength. So we may need to remove more than necessary. So that's not a minimally invasive treatment option. Um, so some people unfortunately think that since so white fillings are better, that's not always true. They are better than the silver ones, but there's risks such as BPA and BPA derivatives that can be released from traditional white fillings. Um, and it's very, difficult to source and find products that are without BPA or BPA derivatives and are free of fluoride, if that's the way that you would like to practice. So there have been studies and that have been released by various journals showing that BPA was tested in urine up to 24 hours after dental placement of a white filling.
Oh my
Um,
gosh,
I don't
that's
know.
disturbing.
I don't know if parents. I know as a parent, I would. I don't. I wouldn't want that for my child.
Mm.
So I've chosen to practice in a way that I would treat how I would treat my own child. So when I develop treatment plans and I choose materials, I keep that in mind.
Wow.
Yeah.
I
Yeah.
think we can greatly appreciate that after learning what we're learning here.
Yeah.
So, how
Unfortunately.
do you practice? Let's dive into some of these things. You've mentioned you're fluoride free, you're
Hmm.
BPA free. You use something called ozone, which I would be
Hmm.
willing to bet that most listeners don't know what that is. Maybe you can specifically kind of talk about what ozone is. I know I'm not super familiar with holistic dentistry. I sought out
Yeah.
who I could for myself out here, but
Hmm.
I did know the one thing to look for is if you can find a dentist that uses ozone, you're kind of at a step above the rest. Now, you're setting a whole new precedent here, in my opinion, because
Yeah.
this is blowing my mind. And you've got, a greater degree of care and consideration when it comes to just the big picture in general. But what are some of those differences between you and the average dentist? And if you could talk a little bit about ozone so people can learn.
Yeah. So, um, what I do is very, very different than a traditional practice. Like you mentioned, I have all these alternatives in my practice because I feel that it is superior to traditional dentistry. Um, Also, I try to be more minimally invasive when I do X-rays. I try to I use digital X-rays, which obviously has less radiation, and I only take what's needed. Um, I have something called it's really cool. It's a 5D scanner, and it's non-ionizing radiation. So what I do is I literally use a computer like a wand, and it goes around the teeth, and I look at a computer and I see if there's any drops in density in on the tooth structure. And if there's a drop in density, I look and I tell the family, like, okay, I see something that might indicate decay, then I'll take an X-ray if I don't see anything visually. So that's really important because if we can be more minimally invasive, I think it's a good idea to do so. In addition, like I do use ozone. So a lot of people don't know what ozone is. So ozone takes oxygen, and oxygen is made of two O atoms put together. So ozone is O3, so it's a tri-atomic molecule and has three oxygen atoms versus two. And its application in medicine and in dentistry has been indicated for the treatment of over like 200 plus pathologies. And it's been more beneficial than present conventional modalities that follow minimally invasive and conservative application. And it has a minimally invasive and a conservative application to dental treatment. So what we do is we take oxygen, we ozonate it, and we use it in gas, water, olive oil, and what it does is it becomes an antimicrobial, and it has the potential to mitigate the growth of harmful bacteria, but also it promotes the growth of the good guys, the good bacteria, and that we need to balance our oral microbiome. So it can be used in dental cleanings. It could be used to stop the beginning signs of decay. And it can be used instead of traditional antimicrobials or antibiotics that are used in dental cleanings that also kill the good bacteria. So we use it in dental treatments to stop decay from growing and in our cleanings.
Mm, I love that. I love that we have options like that because you don't really know that that exists until you meet someone like yourself. And these other dental offices that are, using it. I wish more would use it. I don't know. I guess dentistry might be somewhat parallel, like with mainstream medicine. You only learn what they
Yeah.
teach you. You really have to kind of go off the beaten path to learn the more functional, holistic approach, would you say?
Yeah, totally. And it takes a lot and it to of continued education to keep learning. And I feel like learning is a journey. We all keep learning. We learn a lot from
Absolutely.
our patients too.
So let's jump into tongue ties and
Mhm.
infants a little bit. Um, I noticed on your website, I pretty sure it said you recommend your baby being seen as soon as a tooth pops through. Is that correct?
Yeah, so that's a really good. Thank you. Thank you for bringing that up. So the AAPD, which is the American Academy of Pediatric Dentistry, it recommends actually to do prenatal appointments. So when a mommy is
Really?
pregnant, yeah, it's cool. So they say, and it's not like if you read the guidelines, but it says, see the moms, talk about how decay can be transmitted from a mom to a baby through sharing food and utensils, but also just to give them education, support, guidance to prepare for when the baby comes. They also then secondarily, like you mentioned, recommend seeing the pediatric dentist at or around the first tooth erupting or coming out. So I want just to quickly mention, because you are a doula, some babies are born with teeth, which I think is really fascinating and cool. Some babies are born with teeth or have teeth around like 30 days of birth, like within the first month. But I personally believe that you should see a parent should see a functional pediatric dentist that's airway focused at or around the first month of life. And I'm working with some awesome pediatric dentists to send a letter to the editor about an editor of pediatric dentistry about this, because we can assess for tethered oral tissues. We can give guidance on hygiene, assess cranial structure. We also can give guidance on who to see, so what tethered oral tissues may be, or tongue ties. So under our tongue, there's a band of tissue connecting the tongue to the floor of the mouth, right? It's also known as a lingual frenulum. We all have one, but sometimes that band can be unusually short or thick, and it makes it restricted or tied down. So tongue ties and other restricted frenulums in the mouth can affect feeding, mouth breathing, impair speech, predispose your child to dental disease, cause sleep issues, bruxism, and in infants, it can cause incomplete transfers of milk, ineffective feeds, pain during feeding, and so much more. So I recommend, and ties are just one piece of the puzzle. It's one part. There's so many pieces of the puzzle essentially when it comes to feeding and function. So I recommend seeing a functional pediatric dentist early to assess, and being with a provider that keeps you on track, sees you frequently, recommends coming back, seeing how your child's doing, because there's so much involved with this, and so much that indeed we can do at an early age.
Oh, I believe it. I see, some of this as a birth doula, and even though my specialty is not in lactation, I, obviously am there with the mom usually when baby gets evaluated, and sometimes in those first couple weeks when she's struggling through nursing, and we're recommending
Mm-hmm.
that she sees someone that has a specialty in lactation, because oftentimes a lactation consultant can catch that, but obviously you're, going to look at things to a whole new level. I mean, you're talking about cranial structure and all these different things, and so that's really, really great info. And obviously, we know the basics that it can interfere with nursing, but apparently, so much more. And really, addressing it as soon as possible, it sounds like can really set your child off on the right path for the rest of their life, and even their
Mm-hmm.
health to some degree, right?
Yeah, absolutely. And making sure they stay on track. That's an important part as well.
So let's move into orthodontics, because I remember when I was a kid, I mean, there were some 10-year-olds, 12-year-olds getting braces and whatnot. I do feel like, for whatever reason, it feels like it's getting younger and younger, and longer and longer. My daughter has a friend; she's going to be in braces for a couple years,
Mm.
and I'm just curious. I know your view is entirely different from mainstream ortho. I would love for people to hear, as I would love to continue to learn from you, your view on orthodontics and the approach and how you view it compared to, once again, our mainstream practicing doctors out there.
Yeah, so um, very different. Traditional orthodontic practice is very different than airway centric or airway focused orthodontics. Um, I think that the American Academy of Pediatric Dentistry is really coming around since they have modified the guidelines to state that it's now the standard of care to screen for sleep disordered breathing and to treat orthodontic issues as soon as a child and the parent are willing and ready. So I see underdeveloped jaws as early as 6 months old, believe it or not. And there are appliances and techniques that you can do to help stimulate the growth of the jaws very early on in life. Um, and unfortunately, traditional orthodontics, we become disappointed because dentists focus on the symptoms, the crowding, and not addressing the root cause, and even resorting to just looking at the mouth, seeing the mouth is too small for the teeth, whereas the concept is, why is the mouth too small for the teeth? Why don't we figure out a way to make the mouth bigger to fit the teeth? However, they resort to taking out healthy teeth, bringing the face back, and that unfortunately can destroy a person's life. And I've seen this firsthand. So I'm lucky
Wow.
enough to be able to work with wonderful providers. So I have a Dr. Zaghi, who's my husband, who sees these patients end stage where they're on a CPAP. These are children. These were once children that got their teeth taken out from the orthodontist, their jaws pulled back, and now they have breathing issues because they have smaller underdeveloped jaws that we now understand can cause sleep and breathing issues, ADHD like symptoms, so on. And they're coming to him needing CPAP, potential surgery, etc. And then Dr. Coppelson, who's an amazing maxillofacial surgeon, who has advanced expertise in maxillomandibular advancement surgery, who treats these patients end stage with jaw surgery because they've later developed upper airway resistance syndrome, sleep apnea, or they need surgical expansion techniques. So when kids are young, we're lucky. The bones are so soft, so easy to understand that. There's so much we can do. And when we grow, it requires surgery. And that's when there's fire, the sleep
Hmm.
disorder breathing, the ADHD, the growth issues. So treat when we see the flags. That's what we need to do. When we see the red flags, we have to talk to our patients. We have to listen to what they say, and we have to assess for sleep and breathing. We have to look at their faces, look at their jaws, and treat when we see the red flags. And I think that's the way dentistry. I see some dentists learning, and I think that this progressive way of understanding orthodontics hopefully will be the way of the future.
I hope so, but we're helping pave that way right now, girl. We're going to get the word out. So, would you say sleep apnea? I mean, is it solely linked back to just oral health? Is it solely an oral problem, or is there an actual medical situation taking place that has nothing to do with the mouth?
Yeah, so there's central sleep apnea, obstructive sleep apnea, upper airway resistance syndrome. So no, not always, but structure does play a role, and not only genetics, of course, environment, and like I said, the position of our jaws and the relationship to each other.
Wow.
Mm-hmm.
What would be some of your top tips to moms? Hopefully, we have some pregnant mamas listening. They get in early with all this information. Gosh, if we could just
Yeah.
like jump back in time, like 15 years when I was pregnant and start over, but that's okay. I've got a 11-year-old and a 14-year-old, so we will start doing better right now. We will jump in for what we can do, what's left of their growing years orally here. But what would be your top tips, for moms, for women that are going to have children one day, for moms that are pregnant right now, for moms that have children, just your overall top tips of, obviously find someone like yourself, but any other practical things that you can throw out there.
Yeah, great question. Um, have your child assessed early. Like you mentioned, find somebody that you can work with, right around the first month of birth. It's more than just teeth, like how your child breathes, how your the relationship you have with the dentist, the connection, the bond. It's important. Um, and also, start thinking about products, believe it or not. So if you're pregnant, start thinking about what you're going to use when you give birth. Um, I believe in using clean, non-toxic products, not only for the mouth, but the whole body. And something that you can consider is just learning how to just simply clean the mouth after feeds. What do you do? What do you use? So I would love to give a tip if you're a new mom and the baby doesn't have teeth, go ahead and get a wet gauze, get a pack of gauze, or even a paper towel, something really soft, or cloth wipes. I like these bamboo wipes that are you can wash. They're very soft. There's some organic bamboo baby towels. You can wrap your finger around the towel, put it in water, and just wipe the mouth. First, you wipe the gums, then you wipe the cheeks, then you wipe the tongue, then you wipe the palate. And this does so much. It desensitizes them for when you do start actually brushing. It also helps decrease the chances of gag reflexes. It also helps with massaging. Sometimes you can use this as a massage routine. And it also helps with reminding the child to elevate the tongue, use lateral motions of the tongue, gain that tongue strength. That's important too. Decreases the chances of thrush since you're constantly keeping the mouth clean too. I do recommend when the tooth comes, getting Risewell toothpaste. I love it. Getting a little silicone toothbrush ready. I like mushy personally because I know it's like a very good type of silicone that we use, medical grade, doesn't have BPA derivatives, things like that. And I always show tips like on my Instagram on how to use these things. Age appropriate teethers, those are things that you can use that help, improve jaw strength. And what you use for your teeth matter, how your child breathes matters, who you see matters. So I always recommend just setting early habits early on so that you can prevent disease for the future.
So, in talking about cleaning the mouth, you are also referring to a breastfed baby, correct? I'm afraid to ask what your opinion is of these incredibly horrific sugar-ridden formulas that are genetically modified SHIT.
Mm-hmm.
And yet moms, let baby lay down and sleep and, fall asleep with them in their mouth. And I mean, let's just go there for a
Totally.
second. Like, what are we doing to our babies?
That's really a I remember when I had my son, I was blown away by the things that are in formula. Uh, if you've seen high fructose corn syrup in formula, that's crazy. I can't even believe it because it's so bad for your body. It's setting your child up for disease, and it's so not only bad for their health, but also bad for their teeth, and it does cause disease. It causes decay, dental decay. Cavities are disease. That's disease. It's the number one most chronic disease in children is decay. It's
Mm.
and it's 100% preventable. 100%. So, what we feed our children matters. Unfortunately, breastfeeding might not be an option for some families, and it could be a choice, or it could be um, due to other reasons. So, giving options to children like formulas that have high fructose corn syrup, you can make your own formula. There are ways to do that if a parent chooses to. There's donor milk, or you can use formulas that don't have this high fructose corn syrup. So I think it really, unfortunately, does cause decay. Um, we call it baby bottle rot in dentistry, and
Mm.
it's one of the most severe types of disease. It becomes rampant, um, and I just think that if you have to use it because you didn't know, or because you weren't given another option, you don't know what options out there, you don't have somebody that can educate or support you, there's something called Jack and Jill tooth wipes. You can use them as early as 4 months old. They're made of xylitol,
Mm.
and xylitol comes from birch trees, and it's a natural sugar substrate. And what you do is you take a xylitol wipe, and it has a little bit of like grapefruit, I believe, or not grapefruit, grape flavor, and you wipe the teeth, and it's made so that the cavities or the bad bacteria don't stick onto the tooth structure and cavities don't form. So that's the best way, I believe, early on that you can start wiping and cleaning the mouth when the teeth come in and then it's recommended for ages 4 months and up to prevent the disease from occurring.
I have my xylitol gum in my purse that I carry around to try and be proactive after every time I eat. I chew some gum. But I do want to come in behind you with the formula and just say, absolutely, because obviously I'm aware not everyone can nurse, but I want to empower those of you listening to, and we probably need to do an episode just on formula, but there are definitely differences in formulas out there. Look for the higher quality, the organic, the, non-fructose corn syrup. I mean, you got to look for it. You got to do a little bit of research. You can't just run to Target and grab it, because unfortunately it's not going to be so easy to find, but it's out there. Or of course the option of making your own, that's been suggested, I think, multiple times in the last year or so. So I want to just reference one more thing before we get ready to wrap this up. We did touch on fluoride, but I feel that it's important we take a minute and educate on fluoride, because we are being told at our dentist's office and actually being offered fluoride treatments for our kids. And there's even fluorinated water, like for babies, that you can put in the bottles. And I mean, I am not the fluoride expert, but I know that it is toxic. And I would just love for you to expand a little bit upon that with what your opinion, and so we can educate mom and women to know better about this.
Yeah, so I think some of the most recent, well, there have been plenty of dentists and doctors that have been concerned about fluoridation and fluoride um, from many years ago. But there was a study that was released showing that pregnant women who were given fluoride, so in Mexico specifically, they have fluoride in their salt. So they did a study and found that pregnant women that were exposed to fluoride during pregnancy versus pregnant women that were not exposed to fluoride during the pregnancy, there was a profound decrease in the IQ of the children of the parents that were exposed to fluoride in the pregnancy. And that's what struck a lot of chords in a lot of parents. We're being told fluoride, given sometimes in some states where there's no fluoridated water, they're prescribed fluoride supplements by their pediatricians. And what we need to remember is that we're exposed to tap water, which does have fluoride in many states, all the time. So, how we wash, a lot of times, if you don't have special filters, how you wash your vegetables and fruits, the skin of those will have fluoride after you've washed them or soaked our food. So fluoride is not boiled off when we boil it. It's not boiled off. So boiled water still has fluoride present in it. So people think, okay, well, I boil my water when I do X, Y, and Z. Well, you'll still get fluoride. So I don't think that disease comes from a lack of fluoride. I genuinely don't. I think there are so many other factors that cause decay and disease, and that can include mouth breathing. It could include diet issues and what we're eating. The diet of children has drastically changed from whole foods to processed foods, and that causes acid breakdown of teeth. And I also think, and alongside, potentially, the lack of education and hygiene and prevention. So there's something amazing. It's called hydroxyapatite. And I think, and we found that studies have shown that it's just as effective as fluoride, and it doesn't have those negative side effects. So now that we have these options, I urge families to use pastes with hydroxyapatite in them. And that could be really helpful because what our teeth, 97% of the outer layer of our teeth is actually made of hydroxyapatite. 70% of the inner layer of our tooth, which is called dentin, is made of hydroxyapatite. So what we're noticing is hydroxyapatite pastes not only help fight decay, they help remineralize our tooth structure, but they also help desensitize teeth as well and whiten teeth. So if we can use these better, these other options, I think that will be beneficial for our kids.
Hmm.
And I think when more studies come out, as more studies come out, we'll definitely see more parents gravitate towards it.
Right. Yeah, I've definitely heard my fair share of, my eyes have been opened a bit to fluoride and just the negative health consequences to that. And while it, can supposedly um, prevent or help dental decay or whatnot, I mean, it certainly doesn't come without those risks involved, the negative
Mm-hmm.
impact on our health. And like you said, there is natural options. So that's where we need to wake up and we need to do better. But we can't do better until we know better. And that's why you're here. So, to help our listeners now be able to take action, and they're going to get off of this call, off of this podcast, and they are going to start looking for somebody in their area. Let's start with let's kind of create a tiered system for them, because maybe they're out somewhere in the boondocks and they don't have access to somebody that, is like yourself. So let's start with like your quality of practitioner, like what specifically do they need to look for? And then what would be like a step down from that, maybe? And then maybe one more step down. Like, is there some sort of little tiered system you can recommend that they can look for?
Yeah, so I would say if you're looking for dentists near you, you can go to www.thebreatheinstitute.com, and there's a list of providers that have taken courses specifically to what it is that, like in airway focused dentistry, what it is that's important and how to treat patients. So they've gone that extra mile to get take these continuing education courses, educate themselves, and put it into practice. There's also askthedentist.com, who also has a provider network available as well. So those are two avenues you can use to help find a professional in your area. Also, what you can do is just ask questions. Um, Ask if they work with myofunctional therapists. Ask if they work with ENTs or sleep doctors or speech and language pathologists, and ask what type of materials they use if you're interested in knowing more about what they're providing.
A biological dentist, would you put that in the same category as you, or just you've got maybe a little bit more going on, so you've got more to you? Sorry, I don't have the right
Good
words.
question.
This is not my area of
Yeah,
expertise.
biological dentists really focus on the biocompatibility of the products and what they provide. So I think that's a biological dentist is a wonderful provider that could potentially help you and your child.
Okay. So if someone could obviously, go look up those websites that she said, if the practitioner is just too far out, they're 5 hours away, then maybe kind of start looking for a biological dentist. That would kind of be your next best bet.
Yeah, biological
Okay.
dentist would be helpful. Yeah, that'd be
Okay.
helpful.
Okay. I know it's not you, but it's not what you guys do. But
Yeah,
if there is
no.
somebody out there that, needs to get away from that traditional style of practice where potentially they could be doing more harm than what is truly needed, then at least we know.
Yeah.
Okay, Dr. Nora, where can people find you? Like, tell us your social media, your website. Give us all the things so they can go keep a contact and follow and continue to learn.
Cool, thank you. So my Instagram handle is at dr.norazaghi. And my practice is Breathe Kids Dental. I'm in Los Angeles, California. And you can find me at www.breathekidsdental.com. And I'm really blessed to have families that have entrusted us with their care from so far away, from all over the United States, and then a family even so far as to Germany. I also
Oh my
do see,
goodness, really?
yeah,
Well, then,
I also,
folks, you can just travel to
yeah,
her.
no, I'm kidding. I do see, I mean, yeah, I mean, you don't have to come all the way here, but if you don't find anyone in your area, happy to see you. And I also do see patients virtually too.
Oh, really?
Hmm.
Wow. Okay. Well, that's great. That's amazing. What, how accommodating. Okay, well, is there any last things that you'd like to say or add? I just want to thank you so much for being here. Appreciate you, and gosh, we'll have to have you back. I feel like we're gonna listen. I'm gonna listen to this and have some more questions, and we'll just have to dive in again sometime.
No, I'm so thankful to be here, and I'm glad that we're working towards better health in our patient for our patients and everyone in the community and those that are listening today.
Thank you. Thank you so much for all you do. Thank you for your amazing wisdom, your passion in this, and your willingness to educate and to be here today. We definitely need to get the word out more. I know I've said that multiple times. So, Dr. Nora, thank you so much. Today has been so eye opening. We've learned so much. It's been incredible. So, appreciate your time. And you guys, it's all about knowing better so that we can do better. So, we'll see you next time. Take care and have a great one.